Welcome everyone. It's Dr. Wade again. We are on to week 5. Week 5 is an exciting point because we're past the midterm and we're now getting into the lower extremity. So we've moved on from the upper quarter and we're digging into the hip and the pelvis region this week. This is one of my favorites to look at because most of our movement, daily movement, comes from this region. The hip and pelvis region is really the foundation for every basic pattern from walking to running to crawling to even sitting and posture and the effect of lower back syndromes and so forth. So a lot going on this week. Make sure you pay really close attention to the main movers, the muscles, the nerves, the bones, just the overall anatomy and structure, and then just, of course, the function of the muscles, because we'll apply it later when we get into some of the lower body movements that can be a little bit more complex than the upper body ones. You got a taste of this last week in the lecture notes when we looked at the squat and deadlift and even the rowing exercise. But this week, we're really just focusing in on just the hip primarily. You're going to have a quiz this week on the hip. So make sure that you're reviewing these notes really well, and that you know your anatomy well, and that you're understanding movements and primary movers, the agonists versus antagonists, and so forth. I would recommend before you take the quiz that you not only complete the reading and also do the muscle chart, number 3 on the hip, and then do the CAP 4, which is also on the hip. So that'll help prepare you for the quiz and just help you apply what we're going to go over. Okay, so looking at the chapter notes for this week, we're in the chapter 8, which is titled The Hip and Pelvic Girdle. A lot of notes here derived from the textbook, and there's a lot of detail. A lot of this you could probably kind of skim through. I just talked about some main concepts in the beginning, but pay attention when you start to get into the muscles and the movers. And some of the primary things we'll look at are like degrees of motion, the use of ligaments, because this week we're looking at the hip joint, also known as the acetabular femoral joint or acetabulo-femoral, which basically those two words separated. It's acetabular, which is the socket itself in the pelvic girdle within the ilium and ischium and ramus region that meets together to form the pelvis, and then also the head of the femur. Okay, so some big primary things here are the fact that we have big muscle groups. This is a deep socket, much deeper than, let's say, the shoulder that we looked at last week or the week before. Larger muscles supporting this deeper socket, and also strong ligaments, much stronger in the sense of their size and capacity, ability to bear weight and resist forces than what we saw in the shoulder. Okay. So one thing also to highlight before we get into this, and this is discussed in the notes, but the shoulder is much more of a shallow joint that we looked at. The advantage of the shoulder is range of motion. All right, you can get a full circular range of motion in the shoulder, but the disadvantage is the lack of stability due to the shallow joint and the strength of the muscles. Now in the hip, we have a much stronger joint, but our range of motion is limited because of it. So it's stable, less prone to injury due to the stability factor, but also still prone to injury due to the number of muscles functioning and its impact on the kinetic chain, if you remember that from last week, down the leg. Okay, so some pros and cons there. Wanted to highlight that before we get into it. First thing that the notes gets into on slide 3 is the bones. Okay, I'm going to skip through a lot of the bones, but I'm going to highlight some of the things you should focus in on. It's a ball and socket joint, right? Just like the shoulder. And of course, the advantage is the fact that we're dealing with the pelvic girdle, so it's a deep socket, and the head of the femur is much stronger and longer and bulkier, and has much more regions for like bony regions and landmarks where ligaments and tendons that are connected to big muscles all meet in the socket. So there's an image of the bones on slide 4. It goes through each bone from the sacrum, pelvic bone, divided into its separate areas. I know a good amount of the sacrum. That just that word makes me cringe a little bit. I fractured my sacrum last year while training for a marathon. Stress fracture. That's not fun. Let me tell you, the sacrum really brings the hip together. It's your tailbone. So check out the sacrum, pelvic bone region, the ischium, the ilium, the ramus, all of that coming together to form the pubic or pelvic region. Some landmarks to pay attention to, just where the hip flexors that connect, the hip abductors, the adductors, and the extensors, okay? So when we're looking at those, we're looking at the TFL, tensor fascial latae, look at the sartorius, which is basically your sartorius and even your gracilis together form more of the groin region. Sartorius kind of wraps over and across into the medial aspect of the leg. Rectus femoris, which is what? It's one of your quad muscles, right? It's the only quad muscle, quad meaning there's 4 of them. It's the only one that attaches into the pelvic region. The rest are attached to the femur itself and then down to the knee joint, which we'll look at next week. What else do we have? We have the gluteus medius and minimus, which are our hip abductors. We have our adductors, we got a few of those. We have multiple adductors, the magnus longus and brevis, as well as the pectineus and gracilis on the inside of the leg. Gracilis is also what we often refer to as the groin. Don't pull that. That's not a fun one to pull. You won't be walking well. Gluteus maximus on the posterior aspect is your big butt muscle, which is extending the hip. Okay. All right, it gets into those bony landmarks, showing you some images on where they are. Pay attention to these because that shows you where muscles connect to tendons that connect to the bone and the line of pull between the bones, thus giving you the actions that occur there. Okay, I'm going to skip through there. Talks a little bit about the patella as well, inserting to the quadriceps on slide 11. I'm going to go down to slide 13, looking at joints. Pay attention to the joints, both on the anterior and posterior aspect and their functions. There's multiple slides talking about the joint, how it affects jogging, running motions, rotation, pelvic rotations. I'm going to skip down to slide 18, looks at the acetabulofemoral joint. A lot going on there. Look at the ligaments that are involved there in that deep socket, basically holding the femur in place with the pelvic girdle where the ischium and pubis meet. Some of the ligaments to highlight there are the pubofemoral ligament, the iliofemoral and Y ligament, or Y ligament, same name, and as well as the teres ligament. Okay. And the last ligament it highlights is the ischiofemoral ligament, which is a common one that often results in tear due to poor movement and weak muscle groups or overused muscle groups. Okay. Talks about some degrees of motion for both for flexion, extension at the hip, and as well as adduction, abduction, and rotation. So you can check that out. I'm going to move down to movements, which is on slide 28. I'm sorry, 26 is where it starts. Different movements we're going to look at are rotations are one of the primary ones. So we have different pelvic rotations, both anterior, posterior, as well as lateral, both left and right movements, and transverse, being able to rotate due to the function of the spine as well. Then it gets down on slide 31. It gets into hip flexion, looking at the different movements in the hip. Of course, it's ball and socket, so it moves in all planes. But we can break each one down. We have hip flexion, extension, abduction, adduction. It shows images of each of these: internal and external rotation, diagonal, abduction, adduction, And then in the transverse plane, we have hip horizontal abduction and hip horizontal adduction, as well as the pelvic rotations that were discussed in the previous slides. Just giving you more insight on those, the plane that it moves through, and so forth. Later on in the PowerPoint, it actually shows the muscles specifically and what planes they move in and what actions occur. Then when you get to slide 46, it gets into the muscles. I'm not going to go through each one of these, but I'll highlight a few of the big ones. You want to pay attention to, obviously, the gluteus maximus, gluteus medius and minimus, the hamstring muscles attaching at the back of the hip, as well as the front side. We have the quads, and then we have also the hip flexors. So you have your TFL, you've got your ischium muscle and ilium muscles. You have your pectineus and your sartorius as well. Okay, so it goes through these muscles, kind of talks about their primary function at the hip and some concentrations for where they apply, both in the upward and downward phases, as well as how they function kinetically with the knee movements. Okay. One of the big ones, which I mentioned separately, is the iliopsoas. Pay attention to iliopsoas. Is the iliacus and the psoas major and minor. They come together to form the iliopsoas, which is our primary hip flexor muscle in the center of the each hip joint on the right and left side. All right, so the muscles are broken down into multiple slides. There's, let's see, 15 slides on the different muscles, so be familiar with each one and what action they cause and when they're agonists together versus antagonists. So be familiar with both the movers and the passive muscles during certain exercises and movement phases. Next, after the muscle slides, it shows you the nerves. A lot of nerves innervating this lower area. We have a lumbar and sacral plexus as well as a lumbosacral plexus together. A lot going on there. So it breaks down the lumbar plexus and the sacral plexus and each of the primary nerves that are going through. The major nerves include the femoral nerve going through the anterior muscles and the obturator nerve. And then we have superior gluteal nerve, inferior gluteal nerve, and then the branches off the sacral plexus as well, which include the sciatic nerve, which you've probably heard of, comes out the backside, down the hamstrings. Often when you pinch a disc or pinch something in your hip or like your glute or piriformis syndrome, like the piriformis is a strap under deep to the gluteus maximus. If that ever collapses, it can actually pinch the sciatic nerve, which shoots pain down the leg, and that's not fun. I've had that before, and it's not pleasant. Then from there on slide 70, all the way till the website resources, it goes through each muscle. It talks about the action in each, and they're very complex. So the first one on slide 70 is the iliopsoas muscle, and you can see it has multiple functions. It lists 7 different functions: flexion of the lumbar spine, the psoas, lateral pelvic rotation, flexion of the hip, external rotation of the hip. I mean, there's so many different actions of the iliopsoas. Very complex because it's connecting from the lower lumbar down into the lesser trochanter of the femur, as well as in the ilium to the lesser trochanter. So same insertion points or similar insertion point, different origin points, but still have the same line of pull. So very strong, stable, multi-movement muscle. All right. Then it gets to the rectus femoris, sartorius, pectineus, adductor brevis, longus, magnus, the gracilis muscle, semitendinosus. Now we're getting into the hamstrings. There's 3 of those. So you got the semitendinosus, the semimembranosus, both connecting medially to the knee, medial aspect of the knee. And then on the lateral aspect, you have the biceps femoris, which is the bigger hamstring muscle. It has 2 heads, just like your biceps brachii in the arm. And then your gluteus maximus, the medius and minimus, which are abductors and help with external rotation at the hip. Tensor fasciae latae, which is connected to your IT band, runs down to the lateral aspect of the knee, often the cause of runner's knee. And then there are deep rotator muscles that you're going to look at as well, which there's 6 of them. I mentioned earlier the piriformis. There's also the gemellus superior and inferior, obturator externus and internus, as well as the quadratus femoris, one of the quad muscles. Okay. From there, from slide 86 moving forward, it now gets into the muscle actions, or the movement actions. So we have hip flexion, shows you the agonist, hip extension, abduction, internal rotation, external rotation, and then some websites to follow up with. All right. So a lot of content here. Make sure that you're paying attention to those major muscles as well as the smaller muscle groups that are acting as stability muscles. One of the things to pay attention to that's not quite highlighted, but we'll get to when we apply movement of exercises. Notice that you have main movers, like big muscle groups that are helping like flex the hip, extend the hip, and so forth. But when we start applying them to things like the squat and the deadlift, yes, your gluteus maximus is the primary hip extensor in that exercise. But when you start looking at the kinetic chain effect, while the hamstrings also help extend the hip, they're also the antagonists to the quads, which are extending the knee in that exercise. So you have to pay attention to which ones are active during the movement phases, and also the supporting muscles. So all these muscles that are listed, anything on the inside and outside of the leg now become supporting muscle groups during those exercises as well. So your quads might be firing to extend the knee, and your glutes and hamstrings are firing to extend the hip, but your gluteus medius and minimus are also firing alongside all the adductors, the magnus, brevis, and minimus. Longus, and the gracilis. Those are also firing to keep the knee or the femur from wavering medially or laterally. So very complex in their actions. So, anyways, just want to throw that out there. Keep that in mind while you're working through this material, that this is a very complex joint and there's a lot going on. So go master it. Prepare yourself for the quiz. Enjoy the content. And as always, if you have questions, reach out to me. All right. See ya.